Hi everyone. Today's topic is cerebral circulation. Let us discuss it under the following headings: Introduction, Functional Anatomy, Peculiarities of Cerebral Circulation, Factors Affecting Cerebral Blood Flow, Measurement of Cerebral Circulation, and the Applied Aspects. Introduction. Cerebral circulation, it is a blood flow to the brain. So the blood flow supplies the oxygen and the nutrients like glucose, and it removes the carbon dioxides and the other metabolites like lactic acid. So cerebral circulation has unique physiology and anatomy. So it has unique capillary. So these capillaries in the brain are much less leaky than the other capillaries in our body. So these capillaries are surrounded by glial feet, which provide physical support to prevent the overstretching of the capillaries, and in case of any exposure to high pressure. So it also has the blood-brain barrier, and the function of the brain is related closely to the level of the cerebral blood flow. So even the cessation of the cerebral blood flow for 5 to 10 seconds can make a person unconscious, and if it extends for few minutes, then it can damage the brain permanently, irreversibly. So that's why the brain is highly vulnerable to the disruption of the blood flow. Grouping of arteries near the base of the brain is called as the circle of Villus. This is the circle of Villus. So the anastomosis of the cerebral arteries together. So most importantly, the carotid artery, internal carotid artery, and the vertebral artery anastomose together and forms the circle of Willis. So it is in the base of the brain. So this is named after an English physician, Thomas Willis. So he published it in 1664. So in his work called as Cerebral Anatomy. So brain is mainly supplied by 4 arteries. So two internal carotid arteries and two vertebral arteries. So 70% of the supply comes from the internal carotid arteries and 30% from the vertebral arteries. So together this forms the circle of Willis. So this is below the hypothalamus. We will see that in the next slide. So there are 6 large vessels originate from the circle of Willis, so which supply the whole cerebral cortex. So here you can see, so this is the circle of Willis. So this is the vertebral artery, anastomose together and forms the basilar artery. Cerebral circulation. So the internal carotid arteries divide into anterior and middle cerebral arteries, that is near the, here you can see the anterior and the middle cerebral artery near the optic chiasma, and vertebral arteries, they unite to form the basilar artery. These are the vertebral arteries. they unite and form the basilar artery. Arterial supply of brain. So arteries arising from the circle of Villus. So from there you can see the pale artery, and then the penetrating arterioles, and then they divide down into the brain tissue. So intra cerebral arterioles, and then finally the capillaries. So here the exchange of the gases and the nutrients metabolites happens. So this is the Virchow-Robin space. So easy to remember. Cow, we can see the cow, how it is. So this is the basilar artery. So remember this as a cow, circle of Villus. So this is the tail is formed from the, it is formed from the vertebral arteries, anastomose together and forms the basilar artery. This is the internal carotid artery, and then two anterior cerebral arteries, middle cerebral artery, and then this is the posterior cerebral artery. So the blood comes from the red one, internal carotid artery and the basilar artery, and then the blue one goes to the brain, anterior, middle and posterior cerebral arteries. So this is the easiest way. So as we have discussed, we will just again recall it. So basilar artery, and then these are two internal carotid arteries. So this is anterior cerebral artery, middle cerebral artery, and then posterior cerebral artery. So which this picture doesn't look like a cow, but the previous one was. So remember as cow, circle of Villus. So cerebral capillaries. So these capillaries are non-fenestrated. So they have tight junctions. So as we have discussed earlier, so it has this glial end foot. So capillaries in the choroid plexus are fenestrated. So there are areas in the brain which doesn't have the blood-brain areas. There are 5 areas. So these capillaries are surrounded by n feet of astrocytes. So this induces tight junctions in the endothelial cells. So this is the anatomical basis for the blood-brain barrier. So it limits the ionic transports by means of diffusion and exocytosis and endocytosis, the vesicular transport. And it also provides physical support to prevent the overstretching of the capillaries. So in case of if there is any high blood pressure, capillary blood pressure. So coming to the venous drainage, so cerebral veins, so comes into the cerebral venous sinuses. There are different sinuses. So here you can see the sagittal sinuses, straight sinuses, so cavernous sinuses, sigmoid sinuses. So finally all the sinus gets into the sigmoid sinuses, and then from there it reaches the internal jugular veins, and the cerebral veins, they don't have any walls. So let's get into some of the facts. So the total brain weight is 1400 grams, which is only 2% of the total body weight. But if you see the blood supply, it is around 15% of the total cardiac output. So they receive blood of around 750 to 900 milliliter per minute. So the oxygen supply is 20% of the total oxygen consumption. So it is 46 milliliter per minute in 3.3 milliliter per 100 grams per minute. So though there is an variation in blood flow to different parts of the brain, the total cerebral blood flow, they remain constant. So even the slightest change can bring a major damage to the brain. So it maintains the cerebral blood flow constantly. Metabolism in the brain, so which is only 2% of the body weight brain, and it consumes 20% of the oxygen consumption and 25% of the glucose consumption. So glucose is the major energy source of the brain. Metabolism in brain, so 15% of the total metabolism in the body, mostly in the neurons. So the major need is to transport sodium and calcium ions out of the neuronal membrane and potassium ion into it. So high levels of brain activity, so the neuronal metabolism increases 100 to 150%. So the brain is not capable of much anaerobic metabolism. So glucose enters the brain via glucose transporter 1 in cerebral capillaries. So glucose is a major source of energy. So here insulin is not required for the cerebral cells to utilize the glucose. This point is very important, because in case of diabetes mellitus, where either there can be an insulin deficiency or the insulin resistance, so even in those cases, so the brain, they doesn't need insulin for the glucose to act. So it is insulin independent. Glutamate and ammonia removal. So ammonia is very toxic to nerve cells. So ammonia intoxication. So that is a major cause of bizarre neurologic symptoms in hepatic coma. So glutamate enters the brain. So it takes up the ammonia and leaves us the glutamine. So the detoxifying mechanism happens to keep the brain free of ammonia. Otherwise, the ammonia can easily damage the nerve cells. Regulation of cerebral blood flow. So brain is the least tolerant of ischemia. So the interruption of the cerebral blood flow, even for 5 seconds, can cause the loss of consciousness, and for few minutes it can cause irreversible brain damage, ischemia. So the contractile state of the cerebrovascular smooth muscle depend mainly on local metabolic factors. Cerebral blood flow is maintained by perfusion pressure and also the vascular resistance. Cerebral perfusion pressure. It is the pressure gradient causing the blood flow to the brain. So the cerebral perfusion pressure is equal to mean arterial pressure minus mean central venous pressure. So this mean central venous pressure is equal to intracranial pressure. So cerebral perfusion pressure is equal to mean arterial pressure minus minus intracranial pressure. So any increase in the cerebral perfusion pressure causes increases in the cerebral blood flow. Any factor affecting the mean arterial pressure by means of hemorrhage or the intracranial pressure, then it affects the cerebral blood flow. Cerebral blood flow is maintained normally over a wide range of mean arterial pressure by means of autoregulation, as autoregulation happens in other organs like kidney, heart. Factors affecting the cerebral blood flow. So the lumen diameter of the cerebral blood vessels, and then the cerebral vascular resistance and the viscosity, and then the intracranial pressure, the metabolic factors, that is the carbon dioxide, hydrogen, and the oxygen concentration, and also the substances that are released from the astrocytes. So the vasomotor nerves, so the most importantly the sympathetic innervation. Effects of increased venous pressure. So when there is an increase in the venous pressure, so by means of Valsalva maneuver and the coughing, so that causes the increase in the intracranial tension, and thus that compresses the cerebral vessels, which decreases the cerebral blood flow and also decreases the effective perfusion pressure. Autoregulation. So it is a process by which the flow to many tissues is maintained at a relatively constant level despite the variations in the perfusion pressure. So in the brain, so it maintains a normal cerebral blood flow at the arterial pressure of 65 to 140 millimeter of mercury. So the inherent property of the resistance vessels. So when there is an increase in the blood pressure, that causes a vasoconstriction, and when there is a decrease in the blood pressure, that causes a vasodilatation. So the mean arterial pressure, when it goes below the 60 millimeter of mercury, that decreases the cerebral blood flow and causes the syncope. And when the mean arterial pressure goes above the 140 millimeter of mercury, that increases the permeability of the blood-brain barrier, so that causes a rupture, so that results in hemorrhage in the cerebral edema. Hypertension, so autoregulation occurs even when the mean arterial pressure is 160 to 180 millimeter of mercury. So the mean arterial pressure of the cerebral blood flow so is maintained between the 65 and 140 millimeter of mercury. So this is mediated by a myogenic mechanism. So Mandragora doctrine. So in the cerebral cavity, so it includes the blood, brain, and then the cerebrospinal fluid. So these are the three components of the cerebral cavity: blood, brain, and the CSF, that is cerebrospinal fluid. So when there is any change in one of these three components, so that still maintains the cerebral cavity in the expense of the other two components. For example, if there is any mass over here, you can see there is a mass. So it still accommodates the mass and maintains the normal intracranial pressure by the expense of the CSF and the blood volume. So this is the decompensated state. So the increased size in the mass, and you can see the CSF and the blood volume is completely decreased. So this is the decompensated state. So this is called as the Monroe-Kelly doctrine. Again, this term you will hear in the CSF. So this is one of the important Viva question, or you can also get it in your investing exam. So the brain, spinal cord, and the spinal fluid are encased along with the cerebral vessels in a rigid bony enclosure. The cranial cavity normally contains a brain weighing approximately 1400 grams and 75 milliliter of blood and 75 milliliter of the CSF. So because of the brain tissue and the spinal fluid are essentially incompressible, the volume of the blood, spinal fluid, and the brain in the cranium at any time must be relatively constant. So Cushing reflex, when there is a rise in the intracranial pressure, so that decreases the cerebral blood flow, so that causes ischemia of the vasomotor center, so that increases the activity of the vasomotor center and it releases the sympathetic discharge, and that causes the increase in the blood pressure. So by increasing the blood pressure, it restores the cerebral blood flow back to normal and cause reflex bradycardia and slowing of respiration. That's why when there is a rise in the intracranial pressure, the patient will have bradycardia. So that bradycardia is due to the reflex bradycardia. So this is called as a Cushing's reflex. Let us discuss the effect of carbon dioxide on the cerebral blood flow. So the cerebral vessels are very sensitive to the partial pressure of the carbon dioxide. So the normal partial pressure of carbon dioxide is the 40 millimeter of mercury. So when it goes above 40 millimeter of mercury, that is hypercapnia. So that causes the vasodilatation. When it goes below the 40 millimeter of mercury, that causes a vasoconstriction. So the partial pressure of carbon dioxide of 80 millimeter of mercury, so that causes the cerebral vessels to dilate maximally. So 70% increase in the partial pressure of carbon dioxide causes the cerebral blood flow to twofold increase, and decrease in the 20 millimeter of mercury. So there will not be any further vasoconstriction. So when the partial pressure of carbon dioxide goes below 20 millimeter of mercury, there will not be any further vasoconstriction. This is because this anoxia leads to the production of the lactic acid and the hydrogen ion production, and that causes the vasodilatation, so which nullifies this vasoconstriction. So that's why there will not be any further vasoconstriction. So even the 1 millimeter of mercury rise in the partial pressure of carbon dioxide causes increase in the cerebral blood flow by 3 millimeter of 3 milliliter per 100 gram per minute, and when there is decrease of partial pressure of carbon dioxide by 1 millimeter of mercury causes a decrease in the cerebral blood flow by 1.5 ml per 100 gram per minute. So carbon dioxide, after reaching the brain, it combines with the water and forms the hydrogen ion. So this hydrogen ion causes a vasodilatation of the cerebral vessels, and the removal of the hydrogen ion, carbon dioxide, and the other acid forming substances from the brain, so that depresses the neuronal activity. So the hydrogen ion causes the vasodilatation. So the hydrogen in the blood is prevented from reaching the arterial smooth muscle by blood brain barrier. So normally the hydrogen ion will not cross the blood brain barrier, so it gets into gets converted into the carbon dioxide and then get into the cerebral blood flow. So the carbon dioxide crosses the blood brain barrier, whereas the hydrogen ion doesn't cross it. So the cerebral vessels dilate only minimally in response to an increase in the hydrogen ion of arterial blood. So when there is increase in the partial pressure of carbon dioxide, that increases the hydrogen ions, causes the vasodilatation. So the vasodilatation causes the removal of carbon dioxide and other acid forming substances. So thus that decreases the hydrogen ion to normal. So this normal maintains the constant level of the neuronal activity. So when there is decrease in the partial pressure of carbon dioxide, so there is decrease in the level of hydrogen ions, that causes a vasoconstriction. So that causes a reduced removal of the carbon dioxide. So thus there is an increase in the hydrogen ion to normal. So this normal maintains a constant level of the neuronal activity. Effect of the partial pressure of oxygen. So the rate of utilization of oxygen by the brain tissue is 3.5 ml of oxygen per 100 grams of brain tissue per minute. So the oxygen consumption of the brain is around 20% of the total usage. The oxygen consumption of the gray matter alone is 45 milliliter per minute. So the gray matter is only 600 grams, whereas the oxygen consumption of the white matter, which is around 900 grams. So the white matter oxygen consumption is only 3 milliliter per minute. Gray matter is 45 milliliter per minute. So the gray matter consumes lot of oxygen. So the oxygen mechanism, it is one of the important protective response against the diminished cerebral neuronal activity. So the low oxygen tension causes a vasodilatation, so thus that increases the cerebral blood flow. So high oxygen tension, so it causes a constriction, so it causes the seizures, coma, and then finally the death. So electrical stimulation of the excitatory glutaminergic neurons causes increase in the intercellular calcium ion concentration in the astrocyte food processes. So there happens a release of vasodilator substances from the astrocytes, and then the nitric oxide and metabolites of the arachidonic acid, potassium ions, and then the adenosine. So all these metabolites causes the vasodilatation, local vasodilatation. Coming to the effect of adenosine, so when there is decreased oxygen supply to the brain or increased oxygen requirement of the brain, so there is a rapid formation of adenosine in the cerebral tissue, that is within the 5 seconds. So that remains elevated throughout the period of the oxygen imbalance. So adenosine released into the CSF during the cerebral ischemia, so incorporated into the adenine nucleotides in cerebral tissue. So increase in ischemia, hypoxemia, hypotension, hypocapnia, electrical stimulation of the brain, and also induced seizures. So innervation of the cerebral blood vessels. So sympathetic neurons, cholinergic neurons, and then the sensory nerves. So from the sympathetic neurons, so the neurotransmitter we get is the norepinephrine and also the neuropeptide Y, which causes a vasoconstriction, and cholinergic neurons. So we get the acetylcholine and also the vasoactive intestinal peptide, and then so this also causes a vasodilatation, and then the sensory nerves, from it the substance P, neurokinin A, and calcitonin genes related peptide. So all these things causes a vasodilatation. So the effect of sympathetic nervous system. So the blood flow autoregulation mechanism can override the nervous effects. So when there is an increase in the mean arterial pressure, so when it is exceptionally high, the sympathetic nervous system constricts the large and intermediate sized brain arteries and prevent the high pressure from reaching the smaller brain blood vessels, thus preventing the vascular hemorrhages into the brain. So this is the autoregulation mechanism. So coming to the measurement of the cerebral blood flow, so there is a Ketty's method, so by which the cerebral blood flow is measured by means of the Fick's principle. So this Ketty method, in this the subject is asked to breathe a mixture of 15% of nitric oxide and the air for 10 minutes, and during this period serial samples are taken every minute from the internal jugular vein and also the peripheral artery, and the cerebral blood flow is calculated using the Fick's principle. So that is the nitrogen taken up by the brain tissue per minute by the arterial venous difference of the nitrogen concentration. So there are so many disadvantages as you have to take by pricking into the internal jugular vein every time. So it is no longer followed. So then the radioactive method and the other methods are the CT scan and the MRI, that is the magnetic resonance imaging. So in this, so the regional concentration of the individual metabolites are measured, and changes in the local oxygen utilization are also studied. And then the PET is the positron emission tomography. So the regional cerebral blood flow can be easily studied. So this we have discussed. So by giving nitric acid 15%. So the subject is made to inhale, and we have to take the blood from the intrajugular artery, and then for every minute, and then we calculate the average of it by using the Fick's principle. So the disadvantages, so it provides an average value for perfused areas of brain, gives no information about the regional differences in the blood flow. So it is no more used. So for the rapidly changing blood flow. So coming to the radioactive method. So the radioactive substance that gets injected into the carotid artery. So the radioactivity of each segment of the cortex is recorded with the scintillator. So the radioactivity, so radioactive substance used of the xenon 133, xenon 123 to deoxyglucose. So the advantage is the blood flow to different regions of the cerebral cortex can be measured in conscious patient. So you can see the activity in the human brain at 5 different um, horizontal levels, while a subject generates a verb that is appropriate for each noun presented by the examiner. So, so this light purple, you can see that is the moderate activation, and the dark purple, you can see the light purple and the dark purple. Dark purple is marked activation. So we as a subject to do various activity, and we record during the activity, and we can see the difference. So these are all the different images from which we got. So in the controls you can see that, so during rest, so the area of the frontal area, and then the during the sensory giving, by giving different sensations, by moving the hand while talking, while reading, so while making them to solve the problem, while reasoning. So you can, they've identified all these areas, so using the radioactive imaging. Coming to the applied aspects, a cerebrovascular accident. that is Stoke, Kernicterus. So drugs that cannot cross the blood-brain barrier. So that is penicillin. That's why they don't use the penicillin for the infection of the brain. Dopamine. So to for the dopamine to work in the uh, brain, they give the precursor levodopa. So instead of giving the dopamine. So the any injury, damage, infection, tumors, they disrupt this blood-brain barrier. So avoid hyperventilation in hypocapnia, which decreases the cerebral blood flow, so which can cause the syncope. And then coming to the stroke, so this is the third most common cause of death after cancer in the ischemic heart disease. It is an acute neurological syndrome produced during the reduced oxygen supply to the brain. So there are two types. So one is the ischemic stroke, another one is the hemorrhagic stroke. Ischemic stroke is when there is a block in the blood vessels. So hemorrhagic stroke is when there is a rupture of the blood vessels due to increased pressure. So that is the hemorrhagic strokes. There are two types of strokes. So stroke most commonly happens in the middle cerebral artery. So, so that is by the thrombosis of the middle cerebral artery. So the signs and symptoms differs. It all depends on the area of the affected brain. So it can be hemiplegia, monoplegia, paraplegia, and also the facial palsy, um, and also the aphasia. So even the aphasia differs depending upon the area. So sensory loss, memory loss can happen. So diagnosis can be made by taking history, clinical examination, and identifying the hemiplegia and the clinical signs. So it can be diagnosed by the computer tomography scan or MRI or the color Doppler. So this is the image of the CT. You can see the hemorrhage. This is the hemorrhage. So treatment differs whether it is the hemorrhagic or the ischemic stroke. In case of ischemic stroke, they thrombolize the thrombus and they give anticoagulants, antiplatelets. So these are the treatment in case of the ischemic stroke. In case of hemorrhagic stroke, they have to maintain the blood pressure, they have to reduce the blood pressure, and they have to reduce the cerebral edema. So anti-edematic measurements are given. So they use the osmotic diuresis. So they give mannitol and all. So summary. So the cerebral blood flow is of around 15% of the cardiac output, which is 750 ml per minute. So there are two separate circulation that forms the circle of Villus. So the internal carotid artery and the vertebral artery. So the cerebral arteries are end arteries. So capillaries are non-fenestrated and they have blood-brain barriers. So there are areas in the brain which don't have the blood-brain barrier. Cerebral blood flow is closely coupled with the metabolism. Cerebral blood flow shows regional variations depending on the metabolic variations. It has the property of the autoregulation. So books to read: Hindu Purana, Genong, G.K. Pal, and the Gaitan and Hall. Thank you.